Sad news. The whole family is sick with COVID. So today's video is coming to you in my pajamas. I'm Dr. Megan, your Prednisone pharmacist, and I'm here with an update for all of those who take Prednisone and are wondering what to do about COVID this year, 2022. I've got some updates from my previous videos that have gone viral all about Prednisone and COVID. So if you are in this situation wondering what to do, here's my update. Here we have all of the things that I am taking to help with my COVID. So first of all, if you're on Prednisone, you probably take ibuprofen unless it's an emergency. But if it is, then this is super helpful for not only the fever, but the achiness, my headaches as well. Then I have acetaminophen, which is generic for Tylenol. It also helps with the fever and pain. As you can hear, my voice is really struggling. This is why I'm using Nutranize Zone, because I need to help with the expectorant to clear out all the mucus. I use the DM because it also has a cough suppressant in it, so I can actually sleep at night. Speaking of sleeping at night, I take Nutranize Zone, which is the first and only supplement for people on Prednisone that I invented. There's a morning as well, but to help me sleep at night, I'm getting this. It's got melatonin in it, plus it has vitamin C and zinc in the combination product, so that way you can actually sleep at night. But what else could there be to help? So we have some other new updates. If you are just you haven't gotten COVID yet and you're like, I've got some time, then I recommend before you get COVID to either get your first dose or get your booster dose of the COVID vaccine so that you're ready for the new variants. And then also get your flu shot. And the reason is because the number one thing that kills people on Prednisone is pneumonia. And so you want to prevent any kind of pneumonia that might be happening to you. If you're over the age of 65, you should also get your pneumovax shot. And then you are immunocompromised, which is most people on Prednisone, especially if you're taking over 15 to 20 milligrams per day. You can get a new thing called Evusheld. So it's for people who either cannot take the vaccine or the vaccine response isn't going to be enough. Anybody over the age of 12, you can get the Evusheld. It's 2 injections into your rear end every 6 months, and as long as the pandemic continues. I'm currently feeling pretty miserable, so I recommend this for anybody who is on 15 to 20 milligrams or more of Prednisone or are taking other immunocompromising medications like cyclosporin or tacrolimus. And then if you get COVID and you have not yet, if you get COVID and you're taking Prednisone, I highly consider getting Paxlovid. Because you are immunocompromised, you are at higher risk of bad complications while taking Prednisone and getting COVID. And so Paxlovid is an antiviral combination medication that's pills that you can take. And so you just, it's several pills that you take each day for three pills for 5 days, 3 pills twice a day for 5 days. And so you can ask your doctor if you're eligible for this. The only complication for this one is there are lots of medications that have a drug interaction with it. And so if you are taking certain medications, this is not an option for you, but taking Prednisone alone does not interact. Prednisone is supposed to be just fine with Paxlovid. So that if you have COVID or before you get COVID this fall 2022, here's the latest updates from Dr. Megan, your Prednisone pharmacist. And if you are worrying about vaccine side effects, you can just say me below or click the link below to get my vaccine side effect tips. Signing off is Dr. Megan, your Prednisone pharmacist.